Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can get focused on quality healthcare services. I am your host, Jean Eaton, the practice management mentor with Information Managers. And this week, our guest is Jaeme Adams. Jaeme is the co-founder and president of Swervepay. He is an experienced entrepreneur and has owned and operated companies in the technology and payment space with particular expertise in financial software and development ventures. He has most recently served as the founding CEO of KeyIC, a leader in high-performance digital payment processing solutions. And in that position, Mr. Adams developed a white-label gateway solution to facilitate companies' needs for core technology solutions. KeyIC currently supports thousands of merchants through its own channels of ISOs leveraging this technology. He's previously founded and served as a CEO for Neelix Incorporated, a web development company specializing in internet services, including e-commerce, merchant accounts, online payment processing, and custom development projects. While with Neelix, Mr. Adams developed enterprise-level solutions for major corporations like Harley-Davidson, Sunbeam, Rubbermaid, and others. He also developed Neelix Merchant Services and supported a network of more than 100 payment processing ISOs around the United States. Mr. Adams launched his entrepreneurial career with Smart Computing Inc., a successful computer training business ultimately acquired by the world's largest independent IT branding company. Jaeme, you have lots of information to share with us about technology and the computer space and how to get best practices for managing customer accounts in a clinic. It's great to have you with us. Thank you for joining us.
Thanks, Jean. Thanks for taking the time today, and very excited here to be part of this webinar.
That's great. Jaeme, Swervepay is now in the market about managing customer payment solutions, and in particular in healthcare. How did you and Swervepay come into the healthcare culture? How did you get here?
Well, when myself and my partner Brad Bialis co-founded the company, we looked for problems in certain industries that we felt that we could address by combining technology and payments, which we felt hadn't been done to the level that we wanted to bring. One of those targets was healthcare, and as we say, we didn't throw a dart at the dartboard. It was actually through a lot of research and really subject matter experts in the industry that we knew that talked about how payments from patients within the medical industry are a problem for physicians and providers. So we wanted to address that with the technologies that we have built, kind of building the best in breed, and really wanted to be the de facto payment system when it came for the healthcare industry.
Okay. That's a great reason to come to the healthcare industry. And the type and scope of the clients that you serve, what types of healthcare practices are we talking about?
Our system, our solution is really built to scale. So we've got one provider, chiropractors, to large hospital systems that use the technology. The neat thing when we built it and architected it with our team was to know that we wanted it to work for any size client within any specific industry. And then when we find an industry like healthcare, we kind of critique it and make some customizations specifically to that vertical. And then once we implement a client, once again, whether it be a one provider or a 1,200 provider healthcare or hospital group, with small customization, the product is relevant to all of those different size clients, if you will.
Okay. So customizing is really a nice advantage because each of our practices are unique, just like everybody else. So we want to be able to have that opportunity to provide that flexibility. One of the things, though, that each practice needs to be able to do is take a look at the practice of how you're managing your collections policy.
Mhm.
And we have a summary about 5 reasons that you fail to collect. And the first is not actually having an infrastructure in your organization. And you may not actually have a policy about how you're going to do collections.
Mhm.
What has been your experience about having customers developing that policy, and how can you help them?
That's a great point, Gene. And one of the things that we focus on is the overall workflow at your organization. And we see a lot of gaps in where we could be effective when it comes to the payment, and really focusing on all facets of your patient population. We have the insured, but we also have the uninsured. So we need to look at that overall workflow, help you change. Maybe it's your financial policy, maybe it's how you accept a credit card currently, whether it's at the front desk before the visit or at the end of the day or after at the end of the visit, excuse me. So we really take an overall look at your workflow. We try to improve that business process, which will then help you collect on some of those uninsured patients that you currently are taking care of.
Okay. So one of those things is to make sure that you've got a good workflow in place. We're going to come up with talk about some specific suggestions. Um, Not having staff who are assigned or tasked to actually do the job.
Hmm.
Uh,
Absolutely.
yeah. And then when you have those people in place, you need to be able to provide some training for those folks. So that's another reason why a number of organizations don't maximize the collection that they should have. It's because we haven't made it easy for your staff to do it. And if it's not easy for your staff to do it, it's sure not going to be easy for the patients to actually come up with the payments. Now, I know one of the things that we talk a lot about is the communication plan with the patients. We need to have some words that we can provide to the patients to set their expectations and to help them through that process and to make it easy for the staff to have that conversation with the patients. And we're going to talk about some tools to help you with all of these things that are going to make it easier for you to do the collections in your practice. Is there anything else that you'd want to identify, Jaeme, about things that you've experienced, why clinics aren't maximizing their collection policy?
Well, Gene, I think those last four bullets really focus on a strategy for payments within your medical practice. And I think when we cover this, I think we basically those are the top four in my opinion for getting the most out of your both insured and uninsured patients.
Okay, so let's get into the how to do it part. So, as part of your action plan, one of the very first things that we need is a policy. So, we need to have a policy in your practice about how you're going to collect for uninsured services. And any suggestions about how to define that policy?
Um, yeah, we give examples, of how other clients of ours have changed their policy that has given them, basically the go-ahead to securely message that patient electronically. I think that's very important, because we know that patients want to make a payment, they're just not financially capable or they're unaware of the amount they owe. So one of the things is focusing on, being able to communicate with them in a non-evasive way and in the way we want to be communicated with, and that's electronically. And number two is just laying out what your financial policy at your organization is. I think one of the things that healthcare has done is really focused on care, which is great, but we need to have paying patients as well, and giving them the tools to pay the way they can. And so having, kind of a defined credit policy that you can track at your organization, I think is the great first step in an action plan.
Okay. So having a written policy about what your expectations are for payments, having a fee schedule, and having some clear understanding about who's going to be doing what.
Mhm.
Um, and you talk about having um, one group of people that help with a collection policy and separating that from the actual patient care process. So we're talking about having um, the the business of providing those services and the collecting the uninsured services visibly as a separate stream from actually providing the patient care. Um, what what are your thoughts about that?
Well, I think it's a must. I mean, I think our healthcare providers need to focus on care. You know, there's a lot of health issues that we have in having the doctors and providers focusing on taking care um, and bettering our society is what we should focus on. I believe that technology can take the relationship of, the financial relationship somewhat away from that doctor, that provider patient relationship by leveraging, you know, um, smartphones, email, any kind of electronic um, technology to communicate with a patient separates the debt side of it and the care side of it. And I don't mean debt that you necessarily send to collections. I'm talking just general, AR. So by using and leveraging solutions to take advantage of technologies to communicate with your patients, really separates that part of that piece of the business in your practice.
Okay. So having a separate stream is important, and then being able to make sure that we've got a good communication plan with the patients. And one of the things that we need to start off with is making sure that patients understand what the expectations are as far as payment. So being really clear about what is an insured service and what is not an insured service helps that conversation, and then they're not waiting and wondering, well, what's going to happen next. So having that clear communication plan with the patients becomes a really important part. And ignoring it doesn't make it better for anybody.
Mm, absolutely.
Um, so there are some times that we have the opportunity to provide a payment plan. Um, the patients can express whether or not they're going to pay up front for that service, and you need to establish a policy within your organization if patients are coming for those uninsured services. When are they going to be told that it's an uninsured service? We want to be able to let them know about that before the service is provided. How do we let them know about that? Do they need to sign an acknowledgement that there will be a fee? How much of that fee is going to come up front? How much of it will be paid later? That you have payment plan options.
Mm.
And that's when we can start introducing the opportunity of alternative payment plans. Either you pay cash now, you might accept check, and what are your point of sale and payment plan options. So how does that work in the communication stream about the workflow? What types of options or what types of conversations would you have with the patients at that time?
Well, one of the most important things that you can do is to get a payment type on file. So a lot of times you hear card on file. So whether you're taking amount due for prepay, whether it's a portion of the entire bill, or whether it's just validating a card to have it in your system, that is going to allow you to have a better chance on collecting after care has been given. There's some statistics that say if without a financial relationship with a patient when they leave your practice, you've got about a 20 to 30% chance on collecting that debt. If you have a card on file or a payment type on file, not just cards, or our system works with every payment type electronically, aside from cash. You've got about a 70% chance or higher of collecting on that debt, after care has been delivered and it's figured out what the insurance has paid and what they haven't paid. So I think number one is just communicating with your patients and saying, this is our process, this is our procedure. We're going to validate your card, or we're going to take a small, if you will, down payment, and we are then going to communicate with you during your life cycle here and let you know when you owe additional amounts. And if you cannot pay that in full, we'd be more than happy to set up a payment plan that will automatically deduct from your account X amount. So just having a financial discussion with your patients at your office and then leveraging technology to facilitate that payment is a great part of the action plan.
And being able to come up with some scripts with your staff about how you're going to have that conversation with your clients. So there's different ways that you can phrase the question. Instead of saying how much can you pay, maybe it's how much are you short, or when can you pay. Instead, are you able to come in tomorrow, or can we talk with you about this option that we have for the electronic payment, and you can pay by your smartphone. We'll send you a notice, and we can set up those accounts to make it really easy for you.
Mm-hmm. Yeah, absolutely.
All right. Um, so we need to get a commitment for payment, and then we need to be able to make sure that the staff are actually talking and asking for the payment, putting those words out there to say, and how would you like to pay today, or what options would you like to consider? Any other special phrases that you like, Jaeme?
You know, a great phrase too is how, what would be an amount that would fit into your monthly budget or weekly budget, depending how you want that payment delivered to you. It's just the problem with healthcare is we've always, um, it's kind of been a negative thing to discuss payments with your patients, and it's probably the only industry where that happens. So I think if by changing policy and by, healthcare should be transparent in cost, and it also should be transparent back to the healthcare provider from the patient of what they're able and willing to pay. We don't want people not to visit a doctor or a provider because they can't afford it. We have technology that will work with your budget and let you pay over time, or let you pay in a very easy way that you're used to paying your current bills, whether it be utilities or mortgages or anything. Electronic way is the most advantageous and the cost effective for businesses, including healthcare.
I like that opportunity to be able to let them know that there are ways to make the payment that are the options are there in whatever way that is easiest for the patient to provide that payment.
Mm-hmm.
So we've given them the options with some additional technology, and we can still accept cash. Cash still works.
Yeah.
But having that conversation with the patient to say, this is the service that we're going to be able to provide. It's an uninsured service. You might be able to use that information to get some refunds on your tax or submit it to a third-party payer or somebody like that. So let's find a way that makes it easy for you. It's really good to have as part of your script, as part of your tools about responding to a patient who says, well, I shouldn't have to pay for this. The government should pay for this. This is part of the healthcare service. We need to make it easy for the staff to be able to have that conversation with the patients to say, well, unfortunately, that's not the way that it works today. This is the way that it does work. How can we get a plan that makes sense for you?
Right. And then, just to add to that, Gene, with what we said, part of the action plan of taking that card on file, that gives you the opportunity to maybe take a negative situation, as just an example you gave, and turn it to a positive. So if someone says, well, the government should pay that, we could say, well, they very may well pay for that, but what we're going to do is we're going to put your information on file, and then we'll let you know if they did. And if they didn't, then we can create a financial arrangement that works into your budget. So really, with technology and all the different capabilities, it allows you to keep your front desk staff focusing on care and letting technology focusing on collecting those patient debts.
Right. Okay. And it's also really important that we have that conversation when the patient is there in front of us in the whites of the eyes. That we are not having a conversation by playing telephone tag, trying to leave messages. Get it resolved while the patient is there.
Mm-hmm.
It certainly increases the opportunity that you're going to collect, but actually is a better opportunity to develop that relationship with the patient, with the client, and give you that opportunity to be empathetic, to understand where their concerns are, and to be able to manage that relationship and provide a solution that's going to be beneficial for both parties.
Yep.
Okay.
3 more.
All right. So we want to have a collection policy. We need to have something in writing. We need to have some clear and easy rules that are transparent for both the staff and the patients and the clients. Technology can help us. There are different ways that we can be able to put that payment plan into place. But we do need to make that collection because it's part of that business process. And maybe we need to make that business process separate then from the care process. And there are some staff who are really good about providing caring services and healthcare services, and they're really uncomfortable talking about the dollars and cents side of it. And there's other staff who are really good about talking about the dollars and cents. So let's try and identify which staff have the aptitude and the skill and the comfort level, and they can be our champions for this workflow. Okay. All right. Anything else that you want to add to our action plan here, Jaeme?
No, I think that's perfect. I love the way that's set up.
Okay. So then we want to be able to document the workflow and make sure that all of that information is in place. Now, I like the idea of keeping the healthcare side of things separate from the billing side of things, but we need to recognize that the billing information is sensitive and important. We need to make sure that we've got some good security practices around that as well. And anything in particular that you want to talk about as gotcha moments about things that we need to look after as far as our billing practices and that billing information?
You know, as much as you can, and depending on the type of terminals that you're utilizing, we want the patients to handle their own card information. So we never want to touch credit card information. We never want to write it down. We never want to store it on any kind of paper documents or electronic documents. So part of the payment workflow is just to know the security of how to handle that payment, and try to leverage technology to, have the patient or consumer, I guess for that matter, handling all credit card or payment data.
Okay.
That's a great first step of the workflow.
Right. It certainly mitigates the risks so that it's not something that the clinic manages. You don't have that information, so you don't have to worry about it. And that way, it's also part of that conversation with the patients that you can have to say, if you take this opportunity for implementing this technology, you look after all the banking information. You don't have to give that to us.
Yeah.
And again, that separates the care part from the business and the financial side of things.
Yes.
Okay. So being able to use that technology in that way, we need to make sure that we've got good businesses that we partner with that are reputable. And as a clinic, you want to be able to make sure that you're doing your due diligence to make sure that the business partners that you're working with have a good reputation, that you understand their terms and conditions, and that it makes a good fit for your business option. One of the things that I often find, even with the smaller and some of the larger clinic practices that I work with, is this is very foreign to a lot of people who provide healthcare services, is that they don't get that e-commerce side of things. So they don't do it, and because they don't do it, they're missing out on a whole lot of collections because they think it's easier not to do it than to actually implement a solution that includes that e-commerce. So what can you tell us about the e-commerce side of the business that is going to make it easier for the clinic to feel comfortable crossing over to the dark side and actually implement that e-commerce solution?
Well, the good thing about an e-commerce solution is you can take a payment, anytime, anywhere, during that life cycle of that patient. So as much as it may be foreign, we all use it every day. We all do. And I don't think there's very many people on this webinar that said they do not. From the moment we wake up to the moment we go to bed, we're using some sort of, web-enabled technology. And why not do that for payments? It gives them, access to the information at all times. It helps your, organization drive down costs so you don't have to send out paper. It's 4 times more expensive to collect on a patient payment. So why not use technology to try to eliminate some of those costs? So reducing operating costs, there you go.
Okay. And then if we can make this solution easier, and it broadens the scope of the types of services that you might be inclined to provide.
Yes, absolutely.
Okay, so not only are we collecting on the services that we're currently providing, but the types of services that you might be interested in providing can broaden, so it increases your revenue opportunities.
Right. It actually engages the patient. We as patients are consumers, and consumers want information now. So by communicating or engaging them, we have the opportunity to create new revenue opportunities, as listed in the second bullet point, just by informing them and letting them know the services that you provide.
Right. So we can create more engaging relationships with our patients, and we're building that stronger relationship between the patients and the care providers. And if you've got a stronger relationship with the patient, they're going to tell their friends and families about the service that they're getting at the clinic. The clinic is really great. They looked after me when I was sick, and they actually told me about something else, and I bought that, and it worked really well for me. So a paying client is a better client than a client that doesn't pay, and a paying client comes back. So we've got some ways to be able to reduce those costs and to be able to increase our revenue, so it becomes a more profitable solution. And it still doesn't have to be for some of the healthcare medical providers. Maybe that's not the biggest driver in your organization, but even if you are only collecting $1,000 more than you did before you implemented a solution, that's $1,000 more than you had them when you didn't have. And you're going to find that your workflow is certainly improved. Your staff are trained about how to handle the client payments, and they're going to do that more confidently. And when you have confident staff, you're going to have better engagement with your patients. So it just continues to improve that opportunity. It might be a difficult step to take for a clinic that hasn't gone to e-commerce before, that haven't done that collection process. But we've got some tools and some templates and some education that we can help people with that is going to make it easier for them. So you've got some great videos on YouTube about that entire process. How else can people reach you to find out more information about implementing electronic payment service in their practice?
A few different ways. Feel free to call our toll-free number, and then you'll be connected with a specialist that can answer questions about how you can implement some of these plans and points that we discussed today. Or always just visit us on our website and fill out an information form, and someone will get back to you, typically within 5 or 6 hours, or sooner. Depends how eager, or depends how the phones are ringing that day. But we're always available, so reaching out via phone or website is the best way to get a hold of someone at Swervepay Health.
Okay. Thank you, Jaeme. Is there anything else that you'd like to add to this today?
No, Gene, I think we covered some great first steps. I think with technology, I guess the one thing that I would leave is, if you have to choose where you would go to get care provided to you, and you have a company that is up to date with technology, using e-commerce, has an action plan, really has their act together, I think it will show those patients that you are looking out for them in various different ways. So it's amazing how we can relate a group that is involved in technology to the same extent how they'd be involved in care. I mean, just if you were to go to a provider's office and they had old medical equipment, probably wouldn't want to go there compared to one that has newer equipment. And it's the same thing with technology. By portraying that, technology front, I think you'll not only help collect, I think you'll achieve more patients because you're engaging them in different ways.
All right. That's a great way to be able to wrap up, Jaeme. Being able to have some good front office practices in place, including the financial and the collection side, helps to engage your patients to provide a value added service. And it also helps to empower your staff. And when your staff are empowered and engaged and you're providing the training and the tools and the smooth work practices to make it work well, you're going to have better staff. You're going to have staff that are interested in providing a good service for their patients, and you're going to have more patients that are going to refer you more often. It sounds to me like a win-win situation.
I agree.
All right. Thank you, Jaeme, for your help in getting us over the hurdle to get onto the e-commerce side. We've talked about some policies and procedures and best practices, and we have some articles to support some sampled policies about how you can implement a collections policy in your organization. Jaeme has provided us with some opportunities and some alternatives for doing collections and providing some technology opportunities. And there are ways that we can make this work for you. There are a number of different options out there. And now that you know a little bit more about what is readily available and how things can be customized to your organization, I hope that you take the opportunity to review your policy about collections for uninsured services and find a way that you can streamline that process, train your staff, engage your patients, and improve your clinic practice. This is Jean Eaton with Information Managers, your practice management mentor. We have lots of ways to be able to keep involved and engaged with you. We're here just about every Thursday with a guest about best practices and trusted vendors to help us improve our clinic practices. We have a couple of events coming up soon about helping us with our job search and relationship marketing about improving the practice within the community. So to stay tuned with our upcoming events, and you can connect with us in lots of different ways with LinkedIn, on Twitter, on Facebook, and we now have our podcast available on iTunes and on Stitcher. Jaeme Adams, thank you very much for joining us today. It's been delightful to have you, and I look forward to staying in touch.
Thanks, Gene. Thanks, everyone.